Hi, my name is Abhishek Shah. I am the founder and CEO of Wealthy Therapeutics. We're here based in Mumbai. Honestly, sir, it's being managed in a very patchy way. There are a bunch of applications, there are some electronic medical records, there are companies who help in booking an appointment, there are companies that help in diagnostic tests, but actually, there is no real digital management of diabetes that's happening today, which would have been okay if diabetes was a disease that had a solution like a vaccine or a cure. But because it is a metabolic disorder that actually has a lifelong care associated with it and there is no cure in sight, it's very important that care is available to a patient all the time, 24/7, which currently unfortunately is very patchy and not really available. And those that are available are only solving parts of the problem, but not really addressing the only thing that actually matters, which is improving patient health. So Wealthy was an idea that was born about 15 months ago, based out of a hypothesis that if you truly are going to look towards improving patient outcomes, then you can't build a digital solution just for the heck of it. It has to behave and act in a way in which healthcare acts, which is scalable, reproducible, clinically significant outcomes, and focus on one metabolic disorder and prove not just to yourself but to the world that it works. So when we started a year back or 15 months ago, we looked at this world of digital therapeutics and how can we enable integrated continual care as an extension of a physician or doctor's practice and solve for that time between two doctor appointments where all the damage happens. We were really amazed to see that if 15 minutes of time is spent once every 6 months with a physician, then the balance amount of time which is left where the patient needs to manage that condition of diabetes on his or her own, they're helpless, they're powerless. And because diabetes is such a hard problem to deal with, everyone was failing and complications were arising and cost of care was going up, and the worst thing was that the average blood sugar levels were going up, patients were suffering, and there was no end in sight. We truly believe that if we can solve for that gap but still look at the patient not as a patient but as a user, as a consumer, and therefore build in patient-centric design and build a user experience that takes the best in scientific knowledge, the best that technology has to offer, and package it all in a manner in which the patient can consume it, then actually we bring care to the patient and close the loop on integrated care that finally can achieve better patient outcomes. That was the hypothesis with which we which with Wealthy Therapeutics was born about a year and a half back or 15 months ago. And today, all of this that you see in front of you is a result of that effort. So we work exclusively B2B and B2B2C, which means a patient needs to be prescribed this app by a physician on the prescription pad. Until that point, the patient cannot get access to it. We work differently with pharmaceutical companies, medical device companies, health insurers, and most importantly with physicians and doctors. We're the first app that has now been endorsed by Asia's largest diabetes association, which is the RSSDI, as an app that can be prescribed on the prescription pad by doctors to patients with diabetes. And we only began our journey, we only went live after we got that clinical endorsement, because we truly believe that in a very scattered, very noisy world of applications, how can we be different, be clinically solid, and actually work with the healthcare stakeholder by proving to him that this is not just something that works and can solve for your patient's lives and outcomes, but has been clinically endorsed and has been rigorously tested before it even went live. So we work with physicians in a manner in which we take that physician on board as a practice, we assign a code to them, and that physician can then prescribe the app to his or her patients, which in turn see the app as an extension of the physician's practice. So we do not have an individual relationship with that physician's patient. We work as an extension of that physician's actual practice and deliver care as an extension of the physician to the patient, so that two things happen. One, that entire time between two doctor appointments, there is now an app which is an artificially intelligence powered health coach that is taking care of the patient. We behave as paramedical support for the physician himself and therefore do things that he wants to do or she wants to do for his or her patients but is unable to. And at the same time, get all that data back, to be able to give back to the physician to take better clinical decisions because of the decision support that can come out of the lifestyle and behavioral data, to be able to prescribe better, more accurate medication, and to be able to give the right advice to the physician or to the patient of what to do next. So fortunately it doesn't take too long, because every doctor that we speak to, or every doctor that you will speak to, will appreciate that there is a gap, and right now there is nothing that is solving for that gap. And any solution that comes has to first be clinically solid and has to get a stamp of approval which allows for physicians to prescribe. A prescription pad is a sacred document, and it should not ever be used to be able to prescribe anything that the doctor is not convinced of and that peers have not already clinically tested and rigorously approved. And that's why we spent a year in product development and getting that endorsement and getting that association to give the approval, because in a world of cluttered applications and anything goes, we were very clear that we were here to improve patient health, and we had a responsibility, a fiduciary responsibility, to make sure that we do it right. Now we are seeing the fruits of sticking to our guns. Had we been short-sighted, we could have easily gone live. There is nothing in this country that prevents us regulatory from being able to provide this app to patients. But we were very clear that we're here to build an extension of a doctor's practice. And that means we had to do everything that made sense so that a physician trusts us. Because if a physician is giving a patient a recommendation to use this app, whether it's an extension of his or her practice or not, it is our responsibility to make sure that this does over and above everything that the physician wants and never lets the physician down. Because this credibility, trust, and making sure that you always take care of the patient comes above all else when it comes to anything in healthcare. So it was a huge challenge for us up front, but now that we are past that hurdle and we are actually live and we've been endorsed, it is playing a huge benefit for us, because we stayed true to our guns to build a healthcare company the way it should be built. So we work with different stakeholders. We work with health insurers to be able to reduce risk and bring outpatient coverage, and therefore reduce cost of care and improve access. We work with pharmaceutical companies to improve medication adherence. We work with med device companies to be able to improve diagnostic adherence. We essentially work with healthcare stakeholders, sir. So our goal and our role and our scale up is always going to be with healthcare stakeholders, never individually, as we grow this company and take it to the next level. We remain focused on one problem. We are only a type 2 diabetes company, and it is not because of chance, it is by design. We are very clear that we want to go an inch wide and a mile deep, be the best at what we do, get deeper and stronger about being able to help patients get healthier and help healthcare stakeholders improve the quality of their care that they give to their patients, and we will then take it from there. So for the foreseeable future, we see ourselves sticking to our guns and doing what we do best.
And how about your funding part?
So all of this has been personally financed so far. We've not looked for external funding. We have got a few inbounds to sort of look at how to scale, but for the moment we're actually quite happy personally funding the venture, because we truly believe that R&D and innovation, when you try coupling that with external capital, suddenly there's a pressure for revenue and growth, which may be at the cost of quality of product. And we're very clear that step one, build a product that is here to last, show outcomes that are reproducible and scalable. I think there is never a dearth of capital. I've been a venture capitalist before. There's enough access to capital, but we should only take it at the right time, when we're able to take that capital and do justice, because it is our responsibility for every shareholder, whether that shareholder is an existing employee or the founders or any external shareholder that comes into the mix, that we do what is right for the best interests of the company. And today, the best interest is to make sure we focus on improving patient outcomes.